the organization. They are representing in the advisory group, just so that we all have the opportunity to meet one another, and then we can dive into the agenda that we shared last time. So I'll go first. I think that I have met everyone, but my name is Ina Backus. I'm the Director of Healthcare Reform at the Agency of Human Services. And then I'll kick it off by passing it to the next person, and then ask each person to try to remember to do the same and pass it to someone else if you could. Luca, how about you next?
Okay. Hi, I'm Luca Fernandez. I work at the Department of Health in the Office of Primary Care and Rural Health, and I work on a number of programs that include scholarship and loan repayment, generally workforce incentives, as well as identifying areas of underservice. How about Margaret next?
Hi, I'm Margaret Robinson. I work at the Vermont Department of Health with Luca, and my role is really broad at the health department. My title is the Director of Public Health Nursing, but I work with a lot of programs across the department, as well as with the rural health program that Luca is a part of, and I oversee the patient safety program carried out by hospitals across the state. And I don't know most of you, although I've heard some of your names before. So I am just I saw Victoria first when I logged on, so I'm going to pass it to her.
Hi, everyone. I'm Tori Biondelillo. I'm the Executive Director for the State Workforce Board. And as you know, it was one of the goals of this group to formally be a part of the State Workforce Board. And now you are. So we're here to help with administrative side of the work and help keep things going and catapult on all the progress that you've made. And I'll pass it to Stephanie.
Hi, everyone. I'm Stephanie Pagliuca. I'm the Senior Director for Workforce Development and Recruitment with Bi-State Primary Care Association. We have a recruitment program that does direct recruiting for health professionals, for physicians, nurse practitioners, PAs, mental health, substance use, oral health, and we have a team that works on that with me. And so I'm happy to be here. And Bi-State represents the federally qualified community health centers and other community-based programs that provide access regardless of ability to pay. Jessa.
Thank you. Good afternoon. I'm Jessa Barnard. I'm the Executive Director of the Vermont Medical Society. We're a statewide membership association for physicians and PAs of all specialties and employment settings. We also provide administrative and advocacy support for the Pediatric Association and Family Practice Association. So we do a lot of work in primary care. Thank you.
I'll just jump in. Laura Pelosi, I'm here on behalf of the Vermont Healthcare Association, which is the trade group for all of our long-term care facilities, including nursing homes, residential care homes, and assisted living residences.
And
I can jump in next, Ina.
Thanks, Ann.
This is hi, I'm Ann Bilodeau. I'm the Chief Operating Officer for HCRS, and I'm here representing the designated agency on the mental health side of things.
And how about we go, Patrick? Thank you.
I'm happy to jump in. I'm Patrick Gallivan. I'm the Executive Director of the Vermont State Dental Society, a membership organization of dentists here in Vermont. And with that, I'll toss it to Johanna.
Thanks, Patrick. I'm Johanna Beliveau. I'm the CEO with Visiting Nursing Hospice for Vermont and New Hampshire, and also here representing the VNAs of Vermont as their current president of that board for the association. And I will pass it to Jill, my executive director.
Hi, this is Jill Olson. I'm the executive director
of the VNAs of Vermont, representing home health and hospice, and I will be joining shortly on video. I'm in transit.
And Dr. Marvin.
Hi, my name is Katie Marvin, and I'm a family doctor at Memorial Health Partners in Morrisville and Stowe, and current president of the Vermont Academy of Family Physicians. It's representing the primary care family physicians in Vermont.
And I think Abby.
Hi, everyone. I'm Abby. I work with Tori at the State Workforce Development Board. I'm her executive assistant.
I think that's everyone that's been able to introduce themselves. Great. And as Tori mentioned, this is the second meeting of our group now under the and as part of and the state workforce development board, not healthcare workforce. That's us. So we're happy again to be coming together with the connection and support of that broader workforce development apparatus in the state of Vermont. For our agenda today, we're kind of picking up on the conversation that we had in our last and inaugural meeting in this new structure. And that conversation was talking about the activity that was happening in the legislature at that time, that was drawing upon the healthcare workforce development strategic plan. We certainly saw initiatives from the plan come into the legislation. And since we last met, now Act 183 has an act number, has been passed into law. It was S11. And we can look at the final composition of that legislation as it pertains to healthcare workforce initiatives. And so that's what we'll do today, is kind of walk through what is a part of Act 183, look at how it relates to what was brought forward or put forward in the workforce development strategic plan. And then we'll talk about some initiatives from the plan that are also underway, but that were not reflected in Act 183 because some of those initiatives were actually undertaken in the Budget Adjustment Act in the last legislative session, and we can talk through status there. And then talk about next steps and priorities for this group relative to everything that is going to be happening. A lot of work on the healthcare workforce development front. So unless there are any issues or questions with that agenda or anything that anyone wants to make sure that we discuss today that's not in the topics that I just covered, let me know. There's anything you'd like to add?
This is Jessa. I don't know if it's quite in that list. I had emailed back before we had rescheduled the last meeting about the new relocation worker grant program. So whether we have time today or at an upcoming meeting, I just want to put on the list talking about making any more categories of healthcare employees eligible for that program.
Thanks, Jessa, for that reminder about that question. I think we can put that on the list. I know that there was an attempt to do that, and I actually haven't followed through to see how that might have played out in the final. And I don't know if that's something that Tori or Abby are familiar with.
I can look. I do recall conversations from ACCD opening that up and trying to get rid of any barrier there for the employee. So I can double check and see where that landed. If it hasn't happened, that's definitely something we should consider moving forward into the next legislative session. But I believe they noticed that, and there was a couple other manufacturing jobs that didn't qualify as well. So they wanted to kind of get rid of that barrier for folks. So I can double check on that.
Thank you, Tori. Okay. I will now share my screen if that's okay. I know might be a little boring, but I think it would be helpful for us to all look at the same thing. Is everyone able to see the document that I'm sharing?
Yes, thanks.
Okay, great. So what I did for the purposes of reviewing the initiatives and investments in Act 183 that pertain to the healthcare workforce is I split those investments into two categories, and I'm very glad that Luca and Margaret are here to check my work on this. The first category is sort of investments for the purposes of grants and programs that support employers that may support employers and or nursing schools and that also support more broadly healthcare workforce initiatives. That's kind of the first section. And then the second section is pulling together all of the different investments that were that the bill outlines for scholarships, also known as forgivable loans, as well as loan repayment programs. So really bringing together in one kind of category all of the funds that would be providing for direct financial assistance or relief for persons looking to enter the healthcare workforce, already working in the healthcare workforce, or to advance through the healthcare workforce through furthering education, or to participate in educating the healthcare workforce. So that's how these things are divided. And then what I did was highlight what the initiative is, the section of the act where the initiative is described, the dollar amount, the deliverable, the responsible entity, and then finally how the legislation relates to the healthcare workforce development strategic plan. So I'll try to move through this, and please pipe in if you have questions or thoughts as I go through. So the first initiative is emergency grants to support nurse faculty and staff. And this is a $2 million investment, and all of the investments, unless listed otherwise, are ARPA funds. And here in this program, the initiative is to provide emergency interim grants to Vermont's nursing schools over 3 years to increase compensation for faculty and staff. The Healthcare Workforce Development Strategic Plan didn't recommend a particular investment amount for this activity, nor did it necessarily recommend that this activity specifically was one to support. However, the plan did recognize that faculty compensation may be a barrier to increasing faculty staff for nursing education programs. And the plan, the Workforce Development Strategic Plan that the group all contributed to, it assigned a work group which could evaluate gaps in compensation between academic, faculty, and practitioners and identify possible solutions. So this really component of the legislation moves to a solution and is addressing a problem or an issue that was acknowledged in the healthcare workforce development plan. Any comment here or discussion? Okay. Nurse preceptor incentive grants funded with $400,000. This is a grant to nurses employed by critical access hospitals in Vermont for serving as preceptors for nursing students who are enrolled in Vermont nursing school programs. And this is a program for which the Agency of Human Services is responsible. And the plan, the Healthcare Workforce Development Strategic Plan, recognized certainly that preceptor slots would need to be increased to meet current and future need for nursing students to obtain the required clinical time. Again, the plan itself didn't recommend a grant amount or a program design, but did acknowledge that this was and is a critical issue for increasing the number of students who can be educated in Vermont. The legislation also calls for a preceptor working group, specifically to be convened by the Director of Healthcare Reform or a designee in the Agency of Human Services to identify ways to increase clinical placement opportunities, establish sustainable funding models for compensating nurses as preceptors, or hiring additional nurses to alleviate pressure on preceptors, or both, and to report back to the legislature on this working group by January 15th of 2023. In our plan, we did recommend that the Office of Professional Regulation establish a working group that would, in fact, talk about all three of the types of initiatives that are described above. And I know that that group has or may be continuing to meet regularly. I don't believe that any of the participants are here today, but we do have cross-pollination in our group with that group. And I'm quite curious to learn more from that group about what their action steps are going forward and what they're recommending for addressing these particular issues. Oops. Sorry about that. I don't know if you can still see my screen. So that's a place where certainly we communicated that this work group already existed, and I know that the Office of Professional Regulation spoke to it as well, but the legislature wanted to carry forward the work of the group in a formal convening with the Director of Healthcare Reform.
This is Johanna.
Yes.
Just if I can ask a question about that. I have not had any interaction with that group, and I'm not sure that Jill Olson has either. And I'm a little bit concerned about the gap and not including anyone from home health and hospice care in those conversations. I have students in my organization, as an example, 5 days a week for next year. So it just feels like it would be really important to understand the impact, the need to have clinical placements in home-based care, and the opportunities to offset some of the costs of hosting those students.
I would just add, I don't know that there are any providers currently engaged in that group. So that certainly should be raised as an issue with that group. The focus had been legislatively on making sure they could get acute preceptors and acute care placements, because absent the acute care placements, they couldn't actually enroll any more students. But the intent of our work group was for it to be broader.
So I think I see Jessa has her hand up, but this I think is a helpful conversation to really talk about what the composition of the Director of Healthcare Reform group that needs to be assembled should include, how we would include crossover information from the OPR group, which has been discussing some of these issues, but not all, to Laura's point, and certainly, informing the group with the right participants to make its work successful. So Jessa, your hand is up, and then maybe I'll take down my screen and we can, if you want to pause and talk about this a little bit so that we can document some suggestions about the group, I would be happy to do that.
Well, and I just really wanted to flag that I think the conversation that our work group had for the plan was also a little broader than perhaps both the OPR and legislation that passed, and then it talked about all professions. And I think there are also preceptor bottlenecks for primary care and medical students and other professions. So, which, an OPR doesn't even really touch at least MD education. So maybe not as part of, I don't know that it necessarily fits. I don't want to sort of derail a work group focused on nursing, but I just don't want to lose track of the fact that in our plan, we wanted to put some thought into other preceptor programs as well.
Jill?
Yeah, I just wanted to, thanks, Ina. So yeah, I think similar to what Laura was saying, I think it may be that there's more than one issue here. So there was this sort of immediate, like, get preceptor placements to get nurses finished with nursing school and graduated. And I think the community provider issue that Johanna was raising is making sure that nursing schools are actually training people in other clinical settings and supporting also other healthcare employers who are doing preceptorship. So I think that there may be some different issues, and it might be, I'm not sure how to structure it, but I just wanted to acknowledge that. But this is something we've been talking about for a long time, that the training of nurses tends to be very hospital centric.
Laura?
Yeah, so I think that, the OPR group, I think, got started in response to our set of recommendations. I think they haven't gone as broad as our recommendations included. And so I just want to make sure that that working group takes into account this broader set of issues. And long-term care was a huge component of that focus when we originally met. And I just want to make sure, like, that's different than what the legislature did in terms of like the preceptor grants and those kinds of things. Because again, that was really focused on, we got to enroll students and get them in and out of nursing school. And to do that, we need hospital placement. So I just want to make sure OPR is focused more broadly. Saying the same thing, just differently. I feel like we spent a lot of time on that issue this time last year, so I have a little bit of maybe PTSD.
I think we did spend a lot of time on the issue, and also, like, regrettably, or not regrettably perhaps, but certainly felt that a work group would be best suited to be able to work through the complexity of the issue, whereas we as an advisory group could not get all the way there in working through the complexity. So what I think would be helpful, if you have recommendations for participants in the work group as created by Act 183, I think that would be helpful, but it's also important that there be coordination with the OPR group. And I think perhaps there be some participants that participate in both, if you think that that would make sense. And I can then follow up with the OPR group about where they are and what they have kind of arrived at. But I think we do need to plug in their progress to date, their future projects in with the group that's assigned here. Go ahead, Jill.
Just process-wise, Ina, I wonder if it would be helpful to just make sure we understand what those groups think their charge is, and then we can figure out whether we're asking if we add to the charge, or whether we think there's a different group that needs to meet. I don't feel entirely, maybe others do, I don't feel entirely clear enough to make a recommendation about how to do the working group. So if they think they have a narrow focus and they just want to do that focus, then I think we need a different group potentially.
Yeah, I think that that's fair. I think to the points already made, they may have narrowed their focus for an immediate near term, but that the focus in the advisory group's plan itself is more broad. So I think it's catching up with them to say, like, we understand, where are you in this broader picture, and whether or not it makes sense for healthcare reform director or designee to then join with that work to collect it into the work group that's required. Okay. And just thinking, not that it needs to be answered now, but whether whether there is a designee that might be the appropriate lead in the health, from the healthcare reform AHS team that has some expertise in particular in, in the preceptor model or in a variety of preceptor models. So just something to consider if you're knowledgeable about folks that may have that expertise. I'm kind of looking at Luca and at Margaret. Okay, I'm going to go back now to continue walking through this since we just have half an hour remaining. Try to move more quickly here. Okay.
Sorry, just to interject real quick, Ina, I just got a response back that ACCD secured a legislative change so that there is no occupation restrictions for the relocation grants. So just for folks' awareness, but I don't think it's effective until July 1 because that's a new fiscal year.
Thank you.
Clarification.
Yeah, no, that's really helpful. And I'm glad that that was secured. I knew that it was being worked on. Thank you.
That's great. That's really great news. I know some of our smaller primary care practices were asking about that. Is that something, does somebody have any written information about that could be shared with this whole group so we could make sure to let our organizations and agencies know about that?
Yeah, why don't I work with them to put like a little brief thing together just so it's, the step-by-steps and how it's clear, it will be clear for everyone.
Great. Thanks so much. Good news.
Yeah, thank you.
Okay, healthcare employer nursing pipeline and apprenticeship program was established by Act 183 and provided a $2.5 million investment in this program. This is very consistent with the Healthcare Workforce Development Strategic Plan. This program will provide grants to healthcare employers, hospitals, long-term care facilities, DAs, and FQHCs and other healthcare providers to establish or expand partnerships with Vermont nursing schools to create nursing pipeline or apprenticeship programs or both that will train members of healthcare employers' existing staff, including personal care attendants, licensed nursing assistants, and licensed practical nurses to become higher level nursing professionals. Grants shall commence in the fall of 2022 with a interim progress report in September of 22. This is certainly a very exciting program. Definitely, I think the agency will be soliciting, thoughts relative to like structuring the program. And if you have any of those thoughts to share either now or at a future time in writing, we certainly welcome them. Next, the plan, the Workforce Development Plan recommended establishing a healthcare data. I believe the language in the plan may have been data hub, but I think that it is fine for it to be called a data center. Act 183 provides $750,000 for establishing this center and provides for a full-time equivalent appropriation to operate the statewide healthcare workforce data center in the Agency of Human Services. So this is an area that we will be exploring certainly as we look at recruitment and retention and hopeful retention alongside a healthcare workforce coordinator position, which was also created in the Agency of Human Services specifically to support the healthcare workforce initiatives in the Act 183, as well as to support the initiatives in the strategic plan. So we are working to create these positions and recruit for them in the fastest possible manner, particularly because there are so many initiatives described in the legislation, some with some very tight timelines. We are going to need additional staff to be able to accomplish this programming. So now moving into the sections of Act 183 that provide specific funds for individuals that are working in healthcare, in the healthcare sector. And here, the Vermont Nursing Forgivable Loan Incentive Program is created, building on the existing program, providing for scholarships to students enrolled in an eligible school. And this is a program that will continue to be administered in partnership between VDH and, well, by VDH in partnership with VSAC. And this is consistent with the plan's emphasis that scholarship funding, the workforce development plan emphasis that scholarship funding be increased. $2 million was appropriated by Act 183 for the Vermont Healthcare Professional Loan Repayment Program. And this program provides loan repayment for individuals who live and work in the state as a nurse, physician assistant, medical technician, child psychiatrist, primary care provider. And this program will be administered between VDH in partnership with AHEC. And Luca, feel free to jump in here if you want to add any information. I can go through this information here, and Luca or Margaret, if you have anything commentary you'd like to add, please do so. Further, the legislation provided for $500,000 for the Nurse Faculty Forgivable Loan Incentive Program. This is a new program that provides scholarships to students enrolled in an eligible school, specifically who commit to working as a member of the nurse faculty at a nursing school in the state. Again, a program administered by VDH and VSAC. The Nurse Faculty Loan Repayment Program is also a new program that provides $500,000 specifically for loan repayment on behalf of individuals who work as nurse faculty members. And there's also $1.5 million appropriated for the Vermont Mental Health Professional Forgivable Loan Incentive Program. And this program provides, again, forgivable loans or scholarships for students enrolled in a master's program at an eligible school and who commit to working in Vermont as a mental health professional. And finally, $1,250,000 provided for the designated and specialized services agencies to use funds for loan repayment and tuition assistance to promote the recruitment and retention of high quality mental health and substance use disorder treatment professionals. And as you're familiar, all of these areas were outlined in the Workforce Development Strategic Plan as potential areas to for there to be potential expansion and broadening of these opportunities. Any discussion on those investments from the legislation or questions?
I would like to make a comment.
Yes, thanks, Sam. And Sam, can you let everyone know who you're representing?
Sure. My name is Sam Russo. I am a naturopathic physician, and I'm representing the Vermont Association of Naturopathic Physicians. I'm hoping that we can get naturopathic physicians into the AHEC loan repayment program for primary care providers. So NDs in Vermont do work as primary care providers and do operate patient-centered medical homes, but currently we're not listed as a qualifying profession for that particular program. Thank you.
Thanks. Anything else on this area of the legislation? And any comments from VDH, which is going to be very busy?
Nothing yet. I don't think you left anything out.
Great. Okay, so if there's no discussion on the initiatives that I just walked through or any of the previous, we can move on to talking. I'm going to give an update about the recruitment and retention program that's also known as the premium pay program, which also does reflect recommendations in the strategic plan, as you're familiar. For investing specifically in workforce recruitment and retention opportunities. Jill, go ahead.
I'm sorry, just before you switch topics, I just wanted to share that I still feel like I continue to have trouble like following the bouncing ball on all of the different initiatives and who's doing what and how are we doing and what are we trying to do in this group and when are things due and which things are actually being written and which programs are actually in place versus the ones we're planning on. So I just wanted to share, and I think that's shared by others. I guess I want to test that first of all. Maybe it's just me. But I just feel like, and I'd be happy to help brainstorm about this behind the scenes. I feel like there's more that we need to do to just help this group of people who maybe can't follow every detail understand how to plug in and be supportive of all the different efforts.
Jill, I just want to say thank you for speaking up. And, I was thinking, I recognize some of those programs, that can be leveraged. And obviously it's obvious to me, but not to others, where there's expansion opportunities. Just the comment that you made about the naturopaths. I think about the prior funding sources that have been funding our traditional program and how they didn't quite align to allow that. But I'm thinking this fund could be, and obviously I think there's an opening there, but I'm not working on that specifically. But I know what I know, but I think it's a good point.
So in terms of where there are a huge number of initiatives here. I think there's a pretty monumental number of investments and activities, and we are certainly at the Agency of Human Services, I think, still orienting around all of it ourselves. Yeah. Because some of the activities are ones that we didn't, there's connection to the workforce development strategic plan, surely, and these are areas where the plan and this group, the plan acknowledged, and in the writing of the plan describes some of the problems that then I think the legislation is seeking in some ways to address, but that we didn't necessarily contemplate all of those activities coming to the agency. So where I raised the question, for instance, about, and I'm going to have to go back to it because there's so many, and tell me if this is what you're kind of thinking about, Jill, or not. For instance, the grants to the healthcare employers for the nursing pipeline and apprenticeship program, just thinking through like how that grant opportunity would run, getting some feedback about that, thinking through like what the program should look like, what kind of information we would be seeking, what would maybe even be some evaluation criteria for potential recipients. I think that could be a great way for the group to plug in that's one example of an activity, but is that the type of thinking, or is that what you're thinking about?
Yes, that's exactly it. And I think it's sort of what I'm struggling with is thinking about like how to help my members also plug in and know which things are like, there's already maybe a column that just helps us understand, like, this has a process, this is where that process lives, so that you can see that you can explode into that bigger process. Whereas on this item, this is one where we need to develop it. There is nothing. And so we're starting from zero. That it's hard to know and remember which things already have a path and which things are at ground zero. So just maybe that kind of a status column would just help all of us know, oh, if I care about this, I'm going to follow it to another group and see what they're doing, and maybe report back to this group if I feel like that group isn't doing, big enough charter versus something that really needs our attention. So I think something like that would probably do the trick. I'm just trying to help people who don't like think about this every day in terms of like, what's the plan, be able to hook in.
Yeah, that makes a lot of sense. I think what I can do is add that information here, but also highlight as follow-up, like what we would like some input on very near term. Like, again, the preceptor working group, for example, just we're going to connect with the OPR, but then does that group need to expand in its participants, et cetera? So that's another example. But I think that is doable for us to, or for the Director of Healthcare Reform, me, to kind of come back with this document updated to indicate, all right, these are some opportunities specifically to plug in. And I don't want to speak on behalf of VDH, but I do think that VDH, because they've been administering loan repayment and scholarship programs, may have more of a process established for those activities rather than these new grant opportunities that are also more one-time in nature than these established programs. Does that seem fair to you, Luca, that you're not necessarily looking for input on the scholarship and loan repayment front?
I think that's going to primarily come through our sub-grantees from VSAC and AHEC, but they may be looking for input for sure. I would advise people to reach out to them.
And that may be a place to expand to certainly thinking through how we bring subject matter experts also into the conversation with the advisory group, recognizing that the advisory group is set by Act 155 of 2020. I don't know if I have my numbers right any longer, and that it establishes who the membership is, but that it may be helpful for us to bring in some broader participants, as certainly VDH is a part of that, as well as I think VSAC and AHEC could be. The Office of Professional Regulation is another example. Okay. Just an update on the premium pay for workforce recruitment and retention program. I think that the Agency of Human Services, this is a program that was administered through the Office of Health Reform and the Secretary's office in the agency. And I think there was quite a bit of engagement with the eligible, those who could be eligible for premium pay and workforce recruitment and retention support. And it was a pretty rapid timeline for the development of this program so that we could disperse funds as soon as possible. But I do think that there was some good back and forth and input provided to the team who's been working on this. The premium pay for workforce recruitment and retention program had an online application. I believe it was open for 2 weeks in May. That application closed on June 1st, and the program, per the legislation, or per the Budget Adjustment Act specifically, provides funding to several categories of healthcare and social service employees that were impacted by COVID-19, and specifically to give premium pay to employees in a manner that supports recruitment and retention. and that acknowledges the employees' efforts as they were instrumental through the public health emergency in the last 2 years. And the program is framed and structured this way because it is funded with federal COVID-19 funding, and therefore has, I think many of you may know, some fairly strict parameters for how those federal funds can be used and applied in the state. So that is how the program was framed. At this juncture, we have a preliminary analysis of 141 applicants to the program for premium pay. The AHS staff, and with support by the Department of Financial Regulation, are currently processing these applications in order to meet the target of announcing the grant awards by the end of this month, by the end of June. And we continue to work with the Agency of Digital Services to create the necessary adjustments that will support the reporting that is required. And again, the reporting requirements are also consistent with the federal parameters for this funding. So those reporting requirements all have to be built in an online way so that providers can provide, or recipients can provide, updated information. We anticipate that this reporting function is likely to go live in 2 days. So I think the team is very diligently doing various checks and so on and so forth in these next couple of days. And this will allow not only us to meet the federal requirements for these funds, but also to gauge the program effectiveness and to be able to report back about how the program has impacted the workforce in the state and what kind of workforce development impact it serves. And I think that that's something that is really important as we continue working together in our group. And something I would like your feedback about is, in the creation of the strategic plan, we didn't identify metrics to determine whether the activities were necessarily, yielding result. And I think as we go forward and see many more of the activities come into play, thinking about how we can determine their impact on the system without creating burden to the system, but starting to think about that is something that I think we may want to do, so that we, as we continue working in this forum ongoing, may determine, okay, well, let's say like this or that grant program does not look like it was as effective as another program, for instance, and we may choose to recommend more of some other type of investment in the future. So that's a question out to the group to consider, and to consider how that should happen in a way, again, that's low impact to the recipients of these programs. So we're still validating the requests from the applicants that came in by June 1st, but it looks like there's an amount in the initial request that's looking to be about $32.5 million that will be awarded in total. Again, still validating and looking at that, but that's the way the funding is looking at this time. That's preliminary and not final.
I'm sorry, I just missed that. Could you repeat that number? Just out of curiosity, I missed that.
Yeah. So the Budget Adjustment Act was Act 83. So it's interesting that now we have 83 and 183 both doing these things. It allocated, as you're familiar, I think, $60 million total for the premium pay program, and asked that $45 million be slated for a first round, and that there could be a potential second round of funding for up to $15 million in need-based grants. We are still validating the initial applications that came in, but it looks like the initial applications and the resulting awards are tallying at 32.5 million.
Interesting. Thanks.
Ina, do you know when we'll be notified or when organizations will be notified?
I think a second. The target for announcing the grant awards is the end of this month, the end of June.
Thanks.
So 10 days. I'm sure that the team is working. I know that the team is working busily to meet that deadline. Any further questions or comments or items that you want to raise for the next meeting agenda? In addition to the follow-up areas of working on identifying the preceptor working group composition and connection to the existing preceptor working group, as well as really highlighting where we have brand new activities that could use the input of the group or the group membership that the group is representing. Okay. Well, with that, we can have 4 minutes before moving to whatever our next engagement is for the day. I appreciate everyone's participation and thank you for the questions that you've posed and the items that you've raised.
Thank you.
Thank you.
Thanks, everybody.